Welcome everyone to another episode here, Jaws Podiatry. Today we're going to put out a Q&A video on a more relaxed environment. Got home a little bit early, so I wanted to get to one question that I think a lot of people will definitely benefit from in respect to, we'll just leave it about corns, whether they're seated, IPKs, intractable porokeratoses, seated corns, we'll just say corn for the sake of the conversation. So a lot of people ask me and have asked me, well, before I answer that, let's go back to basics. What is a callus, what is a corn, and why does it develop, right? It's callus tissue as a result of most likely a structural abnormality, a structural problem. If the structural problem is there, it is the root of the cause. The body protects itself by doing what? By creating a callus. Now the problem is that there is really no happy medium, no happy place where you have a callus for protection that does not cause any pain. So I see a lot of people have asked me, well, why don't you take more out? Or why don't you dig out the whole thing? Why don't you take out the core? The core, right? The problem is that if I continue to take out the core more and more and more, you're gonna perforate or break the skin, because the deeper you go, the closer you're getting to the fragile tissue. So you guys have seen me, again, the videos that we have uploaded into our YouTube channel, where I tell the patients, stand up, how does that feel? I do ask the patient. The problem is that a lot of patients sometimes will call back and tell us, or tell me, that their foot is hurting because too much tissue was removed. So it's sort of damn if you do, damn if you don't. You're trying to help the patient by remove and enucleate and remove that core, right? The core of the corn. But if you remove too much, that's going to create pain, because the corn is actually protecting the structural problem. A lot of patients that present, whether they're patients with high arches, what we call pes cavus deformities, that develop a significant amount of calluses underneath the metatarsal heads because their foot is like this, whether on the heel or on the front part, right? The problem with corns is that the recurrence rate is extremely high. I can't tell you how many patients during the day come in just for corns or painful calluses or painful IPKs. I think the bottom line is that there are other ways to minimize the discomfort. Obviously, from a conservative standpoint, we can enucleate. That's immediate relief for the patient. Patient leaves extremely happy, thinking that you're a magician. We're not. Pads, silicone metatarsal pads, any type of, we'll say, coverlet pad, anything that you can actually put on and off. Then we also could recommend some accommodative orthotics to offload the area, right? Some patients have a significant amount of fat pad atrophy. What's the purpose of fat? To accommodate. If you don't have the fat, you're left with skin and bone. The bone has no fat, so that creates a callus, which in turn creates a lot of pain. We'll just leave from a conservative standpoint, semi-conservatively speaking, we do use, believe it or not, we use dermal fillers. In plastic surgery, they use fillers to fill in, wrinkles and deep lines. So we also use dermal fillers to replenish that loss of fat. So we create or recreate that pillow or cushion that was there before, especially in patients with maybe rheumatoid arthritis, autoimmune diseases, patients that have undergone chemotherapy. They've lost, right, the fat because of all of some of these reasons that I've just gave everyone. Another semi-conservative treatment, and that's temporary, by the way, and that's the only problem. It's not covered by insurance, and it's really expensive. And lastly, we have the fat grafting, where we actually take fat from sometimes the belly, the side of the belly, and we transfer that fat to the bottom of the foot. Talk about an unbelievable procedure. What I like to call the Brazilian foot lift. That's what we call it. Where we take some fat and we harvest it, and then we move it to the foot. That's more permanent. And if you're wondering, well, why don't patients just simply elect to pursue surgery, right? If you have a structural problem that's causing the corn, that's causing the pain, which is affecting the daily life activities, why not pursue surgery? And the truth is that, yes, a lot of patients do pursue surgery. Whether minimally invasive procedures or the traditional open approach. Minimally invasive surgery has really changed how we, in respect to the philosophy and the techniques. It has really changed the way that we approach a lot of these clinical presentations. We talk about heel pain, toenail fungus, and definitely corns, calluses. Probably, if not top 3, 4 of the most commonly seen clinical presentations that I think not only myself or our organization, but all the podiatrists see. So going back to the core of the corn, and you guys all see other videos of other practitioners that post that they dig and they continue and they continue. We're not in the business of Band-Aids. We're in the business of healing clinical presentations. We don't focus on just enucleation of the lesion. Again, shaving the lesion, removing the core. It doesn't matter how hard we try, the core will always come back, whether we like it or not. Why? Because there's an underlying problem at the core, which is, again, not the symptom. It's at the core, it's the problem. The symptom is the corn. I hope this video has been informative, educational, of course, but if people are wondering, why not dig deeper and just take it out? Because I know with certainty that corn will come back. I'm hoping that if anyone has any questions in relation to this Q&A, please feel free to post it, and I will definitely, as I always do, I will definitely answer any questions. I hope that I've really clarified some doubts. You guys all, I want everyone to also understand that we can continue to post more videos on enucleations of corns and seeded corns and IPKs, but I don't want anyone thinking that, once we remove the corn, that's it. The patient leaves and never comes back. No, they will definitely come back. We at Jaws Podiatry, we're healers. We're here to heal problems. That's our job. And we will continue to do so as we have always in our core values. That's exactly what we're going to continue to do. So like always, www.jawspodiatry.com, Instagram Dr. ToeJam, Facebook Jaws Podiatry, and last but not least, as you guys all know, Jaws Healthcare YouTube channel. If you think any of your friends or anyone for that matter would benefit from this channel, make a recommendation. I think that with the feedback that I've gotten from you guys, I think a lot of people will definitely benefit. Thank you for watching.